Hello, everybody, and welcome to the show. This episode is brought to you by The Wellness Paradigm, a holistic health coaching company shifting the way that women understand and heal their bodies. Through bioenergetic testing, functional lab testing, and functional nutrition, we uncover what traditional approaches often overlook so you can stop guessing, start healing, and finally feel like yourself again. No more one size fits all approaches, just real answers, deep rooted healing, and the clarity and confidence you deserve to feel incredible. It's time to shift the paradigm of women's health. Now, on to the show. Hello, Brenna. So nice to have you here, Dr. Brenna, I should say. I think we're going to have an incredible conversation here. She is a licensed clinical psychologist and fertility support coach who helps individuals and couples who are experiencing fertility challenges help navigate the mental health side of things, stress, and relationships. And I think we're going to be diving into the mental health side of things, the health side of this, the couples and relationship side of, infertility. And so I'm really excited to open the floor and have you describe a little on who you are and how you got into this work.
Well, thank you so much for having me. I'm excited to be here and share a little bit more with you. I have been a psychologist for over a decade, but I really didn't get into the fertility space until over a year ago, maybe a little bit longer than that, when I started realizing that there was not enough support, at least the mental health support and relationship support in the
Yes.
fertility space. And I know this firsthand because my husband and I experience infertility for many years. My story started actually back in 2017 when I got off of birth control and decided it's time to start a family. And much like everybody that does that, I thought it was going to happen instantaneously. I thought it
Mhm.
was going to be so quick. I mean, as soon as I got off of it, I remember that I was even looking at baby clothes and strollers. My husband and I were just looking at all sorts of stuff. We thought easy peasy, not a big deal. But life got in the way and we were working and having all sorts of things happen at home and stress at work. And his mom moved in with us for a period of time. And all of these stressors, um, we didn't even realize what was going on until about 2 years into our journey. We were confronted with the idea of, wait, this is not happening as fast as I thought it would be. I thought it was going to be super easy. And we started getting stressed and overwhelmed with it. And I remember sitting in the doctor's office when he opened my chart and he said, Brenna, I don't know why you can't get pregnant. Everything looks normal. Everything
Yeah.
looks fine. We've done all the tests. You have been on, I mean, we gave you some thyroid medication because your thyroid looked a little low, but it's not that big of a deal. Everything looks fine. We don't know where to go from here, but so we're going to refer you to a couple of different places. And the places that he referred us to were these fertility specialists that were more invasive treatments,
Yes.
more in depth. And I thought, in that moment, as he's talking to me, I sat there almost paralyzed, thinking, wait a minute. You've got to be joking. You are sharing all of these things, basically saying I'm healthy
Yeah.
and there's nothing wrong with me. But now you're going to tell me that I need IVF or I
Yeah.
need IUI or I need adoption or
Yep.
surrogacy and I need all of these things, but you still don't know what's wrong. And I sat there just crying. And then when he said, so what do you want to do? I almost wanted to shout at the guy. And I thought, I don't know. I have no idea. None of this makes sense to me. So I looked at my husband and I thought, you got anything? Like, I've got nothing right now. And so that really started my whole journey into exploring what else is there out there. And so over the last several years, I started digging deeper into fertility. I started digging deeper into just all things health wise. And over the course of my 7 year journey, what I realized was that fertility is health.
Yes.
Your health is directly related to your fertility. And this is not something that I was told by my OBGYN or my endocrinologist or any other doctor that I met prior to that. And our health is linked to our fertility. And so the barriers in our fertility are really basically stating are showing that there's something wrong with our body. Something underlying is causing this issue.
Yep.
And so I had to do many shifts, many mental shifts along my journey. I had to learn how to advocate for myself with doctors, learn how to advocate for my husband. I also had to learn how to dig in and do my own research. And all of these things were also kind of challenging as a clinical psychologist because I'm a natural problem solver. So I thought, I got this. But between trying to figure all this stuff out on my own, having doctors tell me they don't know, having all of these fertility treatments impact my hormones, I
Yeah.
realized I don't have much control over a lot of things, but I do have control over some things. I have control over my thoughts. I have
Yes.
control over my behaviors. I have control over how I approach this, and I have control over my relationship. And so I really started working all of those things the most as I navigated the fertility world. And so that's something that I do now with couples and individuals is I help them with their relationship. So I help them strengthen their relationship during fertility because it can put a strain on them. But I also help them in a support role to be able to navigate this crazy world where things are thrust upon you and you're just left overwhelmed and you're left with this deer in headlights look of what am I supposed to do? And so that's a little bit in a nutshell what I do and how and why I'm in this field right now.
I love that. I love that you tied all of this in with also just your health because I think that that missing piece is, okay, you're broken, so you can try to do IVF, IUI, or surrogacy or adoption, and that's you're like, but my body's not functioning optimally. Like
Yeah.
there is a reason. And sure, while I can maybe do this, if you're not going into IUI or IVF in a, more IVF in a healthy state too, it's going to impact not only the pregnancy, it's also going to potentially impact the postpartum period as well, And I think that's just not really talked about enough.
Yeah. No.
And while it can be an absolute miracle, I do not want to discount that at all because you can also be in a very healthy state too and need some extra support. Thank goodness
Hmm.
there are treatment, there are things to do that.
Yeah.
I want to kind of dive into when you were going through this health journey, what were maybe
Yeah.
some of the things that you found out about yourself, about the journey, about,
Yeah.
your body that have kind of enlightened you?
Yeah. So one of the things that I learned about with, let's say, starting with professionals, health professionals, every professional has their own opinion.
Oh, yes.
Every professional has their own perspective. Every professional has their own specialty. And if you look at it like that, you realize every single person is an isolated professional. And so there are actually thousands upon thousands of health professionals all around the world helping people get pregnant, get healthy with things that most people have never heard about. And
Yep.
that was one of the most surprising things to me because I started off like most couples at the OBGYN.
Yeah.
And then you're possibly referred to an endocrinologist or a fertility doctor.
Mhm.
But I had to seek out the other things on my own. I went to a functional health doctor
Yep.
where I learned a little bit more about their perspective on underlying root causes. Then I
Mhm.
also went to a NAPRO doctor, which they shared their perspective on underlying root causes.
Mhm.
And then I also went to a homeopathic provider who wanted to share their perspective on underlying root causes. And I think it's important to know that all three of them were different. They were all
100%.
different and their understanding of root causes was different, their
Mhm.
approach was different, but all of them were getting people pregnant.
Yes.
And and what that really showed me was what will get you pregnant is the missing piece to your puzzle.
Yes.
And and that's what a lot of people don't realize when they're jumping to all of these things and they're like, what's going to get me pregnant? The real answer is, I don't know. No doctor knows what's going to get you there. They
Yeah.
have their particular strategies.
Mhm.
And you hope that it'll get you there. You believe it because that could be your missing piece.
Mhm.
But not to lose hope. And that's one thing I share with a lot of my couples and my individual clients is don't lose hope because that's one person.
Yes.
Just keep going to somebody else or go to somebody different. And
Mhm.
that's what I found with my own health journey. Kind of circle back with my own health journey. When I first went to one of the first doctors that opened my eyes was when I learned I went to I think it was a holistic nurse practitioner who taught me charting. They
Mm-hmm.
used the Crichton method to teach me charting, and I've never heard of charting before. I heard of basal body temperature, didn't fully understand that.
Yeah.
I didn't really know what cervical mucus was. I
Mm-hmm.
didn't really know what a lot of these things were until I got introduced to charting. And that opened the door to so many things and actually showed me so much.
Yep.
Then I got introduced to again functional medicine
Mm-hmm.
and then they taught me more about gut health
Yeah.
and how I can heal my gut and how I could detox from certain things.
Mm-hmm.
And I mean, I can keep going into all of the things that I've learned. One of the things that I'm on right now, I can actually share that real quick. One thing that I'm on right now is with my homeopathic provider. I am doing inherited disease tendencies.
Yes.
And that is so interesting that I've never heard about from the other people and how
Uh-huh.
they go into where did you even get this tendency for an autoimmune condition?
Yep.
I thought, I don't know. So we're
Mm-hmm.
actually healing that particular root cause of the inherited disease tendency. And so that's just a little bit about my journey from each one. I'm not sure if you have a particular question about that, but I just wanted to share that with your listeners that each person, each professional has their specialty and the specialty works in a specific way
Yep.
and just to go for it.
Yeah, I love that because I think we often feel we're broken and then we go and that didn't maybe work. And it's no, it's
Yeah.
that approach maybe didn't work. And I mean, we talked a little before we started recording on like
Yeah.
this journey for me and my company too is like functional medicine is incredible, but it misses a lot of that nervous system
Yeah.
and deep root causes, which could be inherited
Yeah.
genes. And that's why, when I got into bioresonance work, it's like you can see that, like,
Mhm.
and they all have their time and place. Um,
Yes.
what I've seen a lot with clients with infertility issues is it might be as simple as you just ovulate really early and you're having sex at the wrong time. So charting is
Yeah.
great, right? It might be that. So I've had clients literally learn about basal body temperature, get pregnant next month. They were just
Yeah.
ovulating at like day 7, not 14, right? Or, clients with, I had a client 43 years old with 16-year-old twins, didn't really expect to get pregnant because she had unexplained infertility. They were
Yeah.
IVF too, and she had crazy levels of mold,
Hmm.
Hashimoto's, um,
Yeah.
hormone issues, heavy. I mean, almost every like toxic load on the body, right?
Yeah.
And once we cleared that, she got pregnant unexpectedly and had a beautiful. Now she has a, I think, 10-month baby boy. Is doing great. But
Yeah.
she was shocked, right? Is because every doctor for 20, 30 years was like, you just
Yeah.
are not going to be able to get pregnant on your own. It's like, no, your body's just under a
Yeah.
chronic state of inflammation. But the
Yes.
nervous system part is, I think, the missing piece too. Because if your body's in a chronic state of fight, flight, or just is burnout,
Yeah.
it wants to keep you safe, right? So for other
Yeah.
people, it's just like your body isn't going to want to get pregnant because it can barely take care of yourself. It's want to
Yeah.
prioritize your body, your healing.
Yeah.
So yeah, okay, let's address that side of things too. And that's, I think, where
Yeah.
not only is nutritional and, supplemental support, but therapeutic support can be really beneficial too, right?
Yeah, absolutely. One thing I see with many clients in the mental health part of it is when they go to their doctor, many times doctors will gaslight them
Yes.
and their symptoms. And I'm not a huge fan of that word, but it happens so often that it's so frustrating. It happens every day. Someone will come in and say, I'm experiencing pain. This happened to me, so I know.
Me too.
It happened to me, so I know. And many of my clients, where you'll go into the doctor and you say, I'm experiencing pain in my ovary. And the answer that I was given was, that's normal.
Yep. Me too.
Or and then, well, no, it's really bad pain. Is it happening during your ovulation window? Yes, that's normal. Well, it's also happening outside of my ovulation window. Is that normal too? Well, that's
It
called
can
a
happen.
cyst. It can happen. And so we'll explain, and clients will explain that they're having this pain, and doctors will completely dismiss it. They'll express their concerns about um, having this fear, their mom or dad had these issues. Do they have to meet with a fertility specialist? And they will get completely dismissed. So all of these doctors that are dismissing actual concerns are increasing anxiety symptoms, increasing stress, increasing depression. And I think the statistic now is 40 to 60% of men and women who are experiencing fertility challenges have anxiety and or depression.
Yeah.
Huge, huge numbers. And part of me thinks it's not just the fact that you're struggling to get pregnant. It's the fact that doctors, the professionals, are telling you something that is unhelpful. And I'm
Yeah.
not here to bash doctors. I've had many good doctors, but I'm just here to say that they have a role to play and they could be
Yes.
contributing to the stress. And they could be contributing to that. And so um that's something that I just see with a lot of people when it comes to their health and not being able to feel like they can't trust themselves anymore. And so that's when I start to see people is when they feel like they're going crazy. They feel like they're going crazy, they can't trust themselves, they don't know what to do, and they just need that extra support or they need someone to just help them realize you're okay. Trust your gut. Let's go figure out what's going on and I'll help you advocate for what you need.
I think that's important where you are helping people advocate too, because doctors have their scope of practice. They don't understand nutrition, nervous system regulation, maybe
Yeah.
to a very high level, like, oh, you're stressed, stop stressing so much. You'll get pregnant, right?
Yeah.
It's like, okay, thank you for nothing. I know when I was going through my health journey, I was like, well, have you, tried being less anxious? Maybe an anxiety medication will do the trick.
Never tried
Like
that.
legitimate chronic pain right now. Like I can't walk and you're just telling me it's all in my head. Okay. Um,
Yeah.
but they have their time and place too, right? And if we only knew how to refer out, and doctors have this very big responsibility too,
Yeah.
and people put all their faith and trust in them. This sounds maybe a little funny and maybe a little like wouldn't happen maybe in our lifetime, but hey, nervous system regulation is really important. Have you ever explored trauma coaching or, homeopathy? They would never say that, you know what I mean? But if somebody did say that, they might be like, huh, well, my doctor suggested it versus me being like,
Yeah.
bioresonance and bioenergetic testing could probably, help you with this. Be like, this is
Yeah.
woo, like,
Yeah. Well, I actually don't think many doctors know about these other
no,
things because they're not trained about that. And so I
no,
don't blame any of them for saying,
no.
I've never heard about that. I don't, and I think that's why they call it like woo-woo or they call it weird because they don't actually know. But I've also met other health professionals, ones that refer to me who will say, I know there's something else going on and I can't get to it. Maybe you can kind of help them process something or work through the stress or work through something to be able to help us remove some barriers and we can kind of come up with um, an idea of where to go next. Because they do genuinely want to help. Health providers that are working with fertility clients do genuinely want to help. And I'm sure it's frustrating for them
Ah,
when they're looking at someone and they think, I have no idea what to do. I've
mhm,
done everything. I mean,
yep,
I had one of my appointments I was working with a doctor. He looked at me and he said, I don't know what else to do. I'm sorry. We've done all that I can do. We've reached the end of my expertise. You unfortunately are the 1 out of 10. One
yeah,
out of 10 where most things don't work. And I
yep,
can refer you to someone or a specific type of treatment, but I don't know what else to do. And as broken as I felt in that moment, and I was crying and just overwhelmed with feeling at my lowest, I also appreciated the honesty so that I can stop wasting my time trying to figure out what else. And so it actually helped me shift my perspective a lot faster when they said I can't do anything and I took my time to grieve through that and I said next. What do I have to do? And that's something that I know with the coaching clients that I work with, that's something that I help them. Let's just pivot. As stressful as it is, we're going to grieve that this person does not know what else to do, and we're going to keep going because what else are we going to do? We're not going to just sit here because that's not helpful.
mhm.
Let's keep going.
Ah, so true. How would you say, what would you say are the biggest emotional or physical blocks that you kind of see with clients or couples, and how do you kind of help them navigate through that?
Yeah, so one of them is the block that and this one can also be true is that I'm doing it all alone. When
Mm,
couples are not on the same page and one feels like they are the only one doing it. They're
Yeah.
scheduling, they're planning, they're telling them when we need to have sex. They're doing all of that. And they feel like they're so alone. And so it's that block because now their body is basically saying it's not safe. You're doing it by yourself. What's going to happen when you get pregnant? And so
Mhm.
that's a mental block that I see with couples, and we need to get them on the same page with communication and with teamwork. How can we get you focused on the same goal so it's not all one person doing everything and the other one is just kind of there for the ride?
Mhm.
Um, and so that's one big barrier I see with couples is not being on the same page. And the way that we again redo work on that is through communication, training, and teamwork and boundaries and all those good things. With individuals, a lot I see the biggest things that I see are you're too hard on yourself.
Yeah, that's hard.
So there's a lot of anger towards yourself. There's a lot of grief that's unprocessed. There's a lot of anxiety with perfectionistic tendencies. I know I had a lot of those tendencies, and sometimes they decide to flare up where you think, what's wrong with me? I should be able to do this. And then you get upset with your body. What's wrong with you? Why aren't you doing this? And coming to a place where you accept your body and accept that what's going on is actually for your own good. Your body's protecting you. And so look doing those mental shifts to say, okay, why is it protecting you that way? Where is that anger actually coming from? And why are you feeling angry? What's holding you back from actually grieving this process, grieving this miscarriage? That's one that I saw where someone would have a miscarriage where she had a miscarriage and then wanted to jump to the next baby,
Yeah.
wanted to jump the next month to have another baby and then would have another miscarriage and then wanted to keep jumping. And we had to talk about you need to grieve, at least grieve a little bit, grieve the loss of these children that you've lost.
Yeah.
And it's not about opening that Pandora's box. And people say, well, I don't want to open the door. We're not opening it like, when you open it for like a ceremony and all these butterflies fly out. We're not going to open all of that, but you open it and let one come out so we can talk about it. Let another one come out. Let's talk about it. But that's the way that you heal. You have to open it up a little bit so you can work through those moments so that your body again feels safe. Your body feels okay to hold on to the next pregnancy or at least to figure out what's wrong. Why are you not holding on to the next pregnancy? And that's why another reason why you need the other health professionals to figure out, is it chromosomal abnormality? Is it microbiome? What could be the cause? But you're not going to be in the headspace to receive. It could be a chromosomal abnormality if you're still grieving from the other ones. And so those are the most common ones that I see with individuals and with couples. And removing those blocks at least help them with their mental health in the moment, which helps them conceive and move on long term.
Yeah, I always say in almost everything is you have to feel to heal. And
Mhm.
as women, especially, we're taught to just suppress and
Yeah,
just move on and
yeah,
and that shows up in a lot of other ways, whether it's maybe carrying another child or it shows up with its nearly gnarly head at postpartum period too, right? And a lot of it is
mhm,
not
yeah,
maybe your hormones. It might have been the fact that your body didn't have that time to process, and that exposes you in a very vulnerable way, And so I think
yes,
that's really important. And I love that you tie in the partner too, because that's
yeah,
that's as women we're taught just keep going, right? Like,
yeah,
and but also on a very physical level, your partner makes up 50% of that egg, like that baby.
yeah,
They have to be in a healthy state too. Like they have to work
yeah,
on their health. I see so many women come to me, they're doing
yeah,
all. And I'm like, okay, but we are hitting a roadblock too.
yeah,
Your husband, if he's not taking care of himself, this might be a missing piece. And there might be something that
right,
we can work on, on a fit, or maybe something more that you have to work with a fertility specialist on. That's fine too. But like also, you guys have to work in combination, right? Because
correct,
otherwise you're going to burn out. And then your adrenals are, we talked about this before, are really in the crapper and suddenly your body
Yeah.
doesn't feel safe to hold a pregnancy. And it's like
Hmm.
the burnout from trying to do all of the things. And it's like this weird, I don't know the right word, like hypocritical almost, where it's like you're trying so hard and you're burning your body out and that's the reason, right? But we don't want
Yeah.
to accept that, right? And
No.
it's like, no, just push harder, push harder. And sometimes maybe
Yeah.
would you agree that some of the best things that you've seen with people to help them get pregnant or move is to do less and take a step back, which is hard, especially
Yes.
when you're like, I hate to say this quotation, geriatric, like 30, mid 30s, where
That's a
it's like,
horrible word. We need to
I
change that
I
because
know.
it starts at 35,
Yep.
which is crazy. You can start at like 60, maybe. We'll throw that over there because then that'll be a shocker.
Oh, yes. I mean, even my
Or
client,
maybe 50s, but 35 is ridiculous.
I've talked to I have many clients that are OBs and OBGYNs, and one of them was like, this, I can't remember the exact thing, but she's like, this is an old statistic, and the statistic doesn't make sense anymore, but we keep making, we fear, and then it instills fear. You're geriatric, and then if you can't pregnant in 6 months, oh, my ticking time bomb, my eggs, and maybe there's a very small percentage. Yes, your eggs decline as you get older to an extent, on a very small percentage, but it's like you're not screwed. We have time. Again, my 43-year-old client is a perfect example of this. Like, but had she
Yeah.
told, oh, you're too old, things are going to happen, I don't know how that would affect the nervous system and the response on your body, and you don't feel safe anymore or like your body's your
Yeah.
own.
Yeah, absolutely. And one thing I like to tell clients and just people that I speak with is it's so important to know when to pause and when to reset and when to push forward.
Hmm.
When do you need to pause and just take a mental break? Take an emotional break, take a relationship break where you're just focusing on something specific. You're kind of putting fertility mindset to the side. Maybe you're trying during the ovulation window, but it's not all about that. You're pausing, you're really giving yourself time to grieve, really giving yourself time to strengthen your relationship and build that foundation for your future family.
Yeah.
Or how do you know when to pause? And then I also say, well, sometimes you need to reset when you're going down a path that is not working anymore. Stop beating on a door that's turned into a wall. It is no longer a thing. Start turning, go somewhere else. And then there's other times where some people need to dig a little bit deeper. And that's when I say, sometimes you need to persevere and advocate for something. And if you're advocating too much, or if you're getting to a point where it's not working, then maybe go back to pivot or go back to pause, but kind of fluctuate between those three things and learning how to navigate between those because the longer you're in this journey, whether it's fertility or just health in general, you really need to know that you have those options, but you also need to know that you can move between them.
Totally. I think what would be maybe helpful, or do you have any powerful stories on helping
Yeah.
move, people or clients through mindset shifts, therapeutic approaches, help them feel more like in control, supported?
Yeah, I had a couple. I'll speak with this one woman that I was working with that part of her concern was stress at work,
Hmm.
and she was really stressed because she's a doctor, and the clinic that she worked at scheduled her nonstop. And she was scheduled nonstop. And even during times were supposed to be breaks for her, they would schedule in walk-ins.
Mm,
And she never had a break. And she felt overwhelmed.
yeah.
And another thing that she struggled with was she was dealing with some various health issues and she couldn't stand for long periods of time. So she would have to take a break and sit down, but she didn't want to tell this to her supervisor because her supervisor was condescending, was very aggressive, was having all sorts of problems um, with the people that were working there. And so it was a very toxic work environment. She was feeling overwhelmed. So one thing that we did was we discussed what her goals were and how this particular practice was treating her and what she wanted to do about it. And so we discussed the options of adding boundaries in. We discussed the options of being able to communicate with her boss. We discussed the options of staying and going. And in this particular situation, she decided to go.
Mm.
And so what we decided to do was, since you're going to go, what would be a good idea is if you start practicing these tools. And so I gave her a couple of tools, and we practiced boundary setting, we
Mhm.
practiced communication, and we practiced advocating for what you need at work. And so some of the things that she needed were, she needed a strict schedule, she needed her schedule respected,
Mm.
and she needed people not to change it. She also needed a couch or a chair in her office and time to be able to decompress. So those were some of the things that she really wanted. And
Mm.
so, since she already had one foot out the door and she said, I'm ready to leave, I said, this is a perfect time to practice all of it because you have nothing to lose.
Yeah. Yeah.
And she did. She practiced all of it, and she got a little bit of confidence and said, I'm ready to go. And so she quit. She quit, and then she went to another practice and went in with that confidence, and went in with not necessarily demanding, but went in with the confidence to say, these are my guidelines, these are my boundaries, and this is what I want.
Yeah.
And they gave it all to her,
Yeah.
all up front. And she said, I want it in my contract. They even provided a couch. So by the time she started, she had a couch in her office
Mm.
with a space. Her office was in a specific space that was the quietest of the offices. And she got more than she asked for. And the most powerful thing about that was, all of her new coworkers said, what are you doing? What are you doing that's so different that you're getting respect? You look so happy. You have no stress, because with all of that, she reduced her stress
Of course.
significantly. She even told me that I decided to start eating better.
Yep.
And I have now more motivation to exercise.
Oh,
I
yeah.
have more sleep. And my actual health is improving drastically because she had
Mm.
deep health issues,
Yep.
um, and her health was improving. And we all know, like I said at the beginning, health is fertility. And so if you have that health, you have that fertility. And so just by putting those things in place, she was able to not only have a better work environment, but then she also had better health overall.
Yeah.
And so that's just one amazing story that I love to share, that it's a little bit long, but it encompasses how much control you have over things and all these little tweaks that you can do. I know not everybody has the ability to just up and quit, but at the end of the day, the mindset that I like to share is, what do you got to lose? You're either going to be in a toxic workplace or you're going to be in a better workplace. Either way, you're going to feel better about yourself because you tried something different. You're not taking this crap anymore. You're not taking this anymore, and you're just going to try, because it either stays the same or it gets better. It can't be
Mhm.
any worse. If it gets worse, you're over it.
Yeah, boundaries are one of the biggest things. I mean, I've seen so many women quit their jobs, switch jobs, and then suddenly drop 20 pounds, suddenly get pregnant, suddenly, their migraines go away. It's like, okay, I mean, we did all the supplements and all the testing, but overall, if
Yeah.
your body still just doesn't trust the environment, and we're so scared to speak up for what we want. And honestly, it's because so often it does get shut down. Do you know what I mean? If you don't come
Yes.
in with that boundary too, it's really hard to pedal back, right? When
Yeah.
people already view you as maybe a little punching bag, right? And
Hmm.
so, starting fresh, while maybe is difficult and maybe not the option for everybody,
Yeah.
that's the importance of setting those boundaries early too.
Absolutely. That's one of my favorite things to help clients through, is because we'll talk about, let's list out what your boundaries that you want to do, and then we'll role play. We'll role play. Tell me what you would tell your supervisor. And if you don't like it, let's change it. Let's give you a mini script to be able to tell them. And so that they have something to say. And so when they say it, they'll come back and say, oh, that worked. Or that didn't exactly work. How can I tweak it so that they receive it better? Or how can I go to somebody else? And so just having that person to be able to bounce ideas off of and practice, really, really helps a lot. And it helps reduce the anxiety about putting boundaries, because that's one of the biggest issues that I see with clients, is the anxiety and the lack of confidence. I
Yes.
think that's also why people don't speak up to their health providers, is the anxiety of what they're going to say to them, and the lack of confidence of, who am I to question a doctor?
Yeah.
And my husband says it so beautifully every time he tells this to clients, whenever we do couples coaching. He tells them, your doctor is your health advisor. They're not the decision maker. They are there to give you advice, and that's it. You are there to get the information and decide what you want to do.
It's true. Putting the power back in your hands,
Hmm.
we oftentimes want to give that away. And there's so much power in taking it back. You know what I mean?
Yeah. That's one of the biggest things that increases confidence. Once you realize, wait, I have more power than I realize. I can reduce the stress by changing some boundaries. I can improve my health by changing some of the things that I eat or by moving a little bit more or just removing toxic people. That's another big thing that I see with people. If you start removing some toxic, and they don't have to be super toxic, but if they're very negative and putting you down and saying things are impossible, that's very unhelpful and your body feels it. They feel
Mhm.
that negativity um coming towards them, and so your body is unsafe with that person. And so just kind of getting around more supportive people, people that want to encourage you, people that are empathetic, people that bring joy and bring just that light that says, I'm here with whatever you decide. I'm not going to have judgment if you decide to do one thing or another. I'm just here to support you.
That support is everything. If you could, leave listeners with one message or one piece of encouragement, um, maybe specific for their fertility journey,
Mm.
what would you say?
What would I say? I have so many things that I love sharing with people. I'm just trying to think of like one thing I would say is that
Maybe two or three
it's
if you
not one, again, going back to one thing that I said earlier is don't put all of your energy and your hope into one person. They don't have the answer. The only person, if you're going to put all your hope in something, one single thing, that's God. But no person on this earth has the answer. No single person has the answer. And so, as you are working with a health provider, if you feel like you want to ask a question, ask a question. Worst case scenario, they say, go somewhere else. Perfect. I was going to go somewhere else anyways if you didn't have my answer. And so
Yeah.
don't put all of that hope. And I think that's where a lot of people struggle is when they put all of their hope into this one IVF doctor. Keep searching because there's help and there's hope out there for you. So keep searching, keep trusting that there is an answer because I've seen it. Shannon has seen it. There is an answer out there for you. And if you need support, you can reach out to me or somebody else that's in this community to be able to help you navigate through that.
Yeah, thank you so much. I appreciated all the insights and it was wonderful. And please let us know where can people find you.
Yes, I really enjoyed this conversation. I loved being able to talk about the health aspect of this and how everything is connected. If you want to learn more about me and my services, you can go to my website, encourageandempowerwellness.com. You can also follow me on Instagram at Dr. Brenna Squires. If you want to just chat, you can also send me a DM there and we'll see if we're a good fit, and go from there.
Perfect. And I know she's got some amazing free resources on her website too, to definitely go check out. Um, so thank you so much. I will put that down below in the show notes. And as always, if you found this helpful, we'd love to hear a review or a comment on what hit home for you or share it with somebody that might really need to hear this. So thank you so much. And Brenna, thank you for coming on the show. And
Thank you.
thank you, listeners. I will catch you on the next one.